I'm Mike Caravelli from the center here in Bend, Oregon, here to have an opportunity to talk about the impact of technology on total joint replacement. Thanks everybody for joining us. We're going to talk a little bit about hip and knee replacement and how the impact of technology has changed the way that we perform these procedures over time. We have the good fortune of having the opportunity to utilize a lot of new technologies that have been brought here over the past 10 to 15 years. As a result of these new technologies, it allows us to really have a good focus on patients' quality of life and designing an operation to enable people to have a reconstruction that allows them to have predictable function and pain relief that allows them to participate in activities that they desire. So when looking at total joint replacement, the beauty of the procedure is being able to predictably allow people to get rid of the pain that has been causing some limitations in their function over time. But at the same time, we can preserve the ability of that joint to function how it has in the past with respect to having good range of motion, predictably being able to ascend and descend stairs, being able to participate in the exercise that's so important for one's well-being, and being able to just enjoy those particular activities, which might be spending time at a family member's football game, or going out hiking, or riding your bike, or participating in any of the activities Central Oregon provides. From a surgical standpoint in doing total joint replacement, if you go back to 1970, over multiple decades, the approach to surgery has changed quite dramatically. We started out at one point with pretty standard instrumentation using manual jigs that maybe even machinists would use in certain cases to be able to reconstruct these joints. Over time, we've been able to marry the technologies of imaging, marry the technologies of engineering, and some more significant technologies such as the use of robotics, computer navigation. By bringing all of these technologies together, what we've been able to do is more predictably restore an independent person's anatomy, because as we all know, people's anatomy varies quite significantly in the size and shape and motion, and also people's desired activities change, and this allows us to be very responsive to an individual's needs. The common steps that one takes in determining whether someone will have their desired result after a total joint replacement, first and foremost, is understanding that that particular individual has pain that's being caused from that arthritic joint, in most cases being a hip or a knee in our particular world. When you know that that particular joint is a pain generator for that patient, you can then get to a point of having the confidence that when you get in there to do that joint replacement, that that patient is going to have a predictable relief of pain from what they have experienced over many months, and even in some cases years, that's caused them to either have a quality of life that's not quite satisfactory, or potentially in some cases, maybe even have their independence somewhat threatened because of the severity of what they've been experiencing. When you then look at each individual joint, whether it's a hip or a knee, you can then focus on, well, how do we get that particular function back, that predictable function that allows someone to go down the stairs, that allows someone to predictably get up off of a chair or be able to get into and out of a car, being able to sit for a drive, across the pass. All of these things are the typical goals of a patient that is deciding to undergo a joint replacement. When you look at the steps that we've used in the past, we refer to that preparation step as templating. We have the opportunity to use the x-rays that we've gotten in the course of a visit with a patient to truly identify with the instrumentation that we have, how can we reconstruct that individual's anatomy so they can predictably have that function that they're looking for. We used to use an x-ray and we'd have little overlays that almost look like a shrinky-dink, to be honest, to be able to identify what size joint is going to fit that patient exactly. Over time, it's gone from that clear overlay to be something digital, where you actually can digitally look at, let's say, the size of a hip replacement or look at the size of a knee replacement and how you might apply that to a given patient's anatomy. As time went on, we decided to look at other ways to do this. We can actually fabricate custom designed devices in order to match that particular patient's anatomy to make it as individual to that patient as possible. And now what we've resorted to over time is that we're using imaging techniques in many cases to be able to create a three-dimensional cartoon or representation of that person's knee or hip that allows us to very precisely identify what particular sizes or components we would select to recreate that person's anatomy. The way we do that in the current state is that we use robotic technology, and what is really nice about robotic technology is it has a CT scan that allows us to create this three-dimensional representation of what that patient's anatomy is. And from that model, we can identify exactly where those components need to be in order to create that function that one's looking for once they've recovered from that joint replacement. The robotic technology is not special in that it is any less invasive than a traditional knee replacement or any less invasive than a traditional hip replacement, but it allows us to have that capacity to individualize the outcome for that patient that matches them and doesn't make an assumption that everybody's similar. So when you're looking at what has transpired in Central Oregon, there's an actual history that's really important to look at. One of my predecessors and partners, Dr. Knut Buehler, was one who brought an immense amount of technology to the stage in Central Oregon in doing knee and hip replacement. He was a participant in the development of a computer navigation tool that allowed us to look at these joints very different than we have in the past. In fact, when I was in my training back in Chicago, one of the surgeons, Rick Wixon, who I worked with, was actually working with Knut Buehler to help develop this computer navigation. What was unique about Buehler in what he brought to this community is he brought a level of technology and understanding and teaching and education for other surgeons in Oregon that really allowed the other orthopedic surgeons in this community to really embrace technology and seek at doing it a better way. And I think to look back at Buehler's contribution to this is very important. Over time, all of the senior surgeons that work in this community have embraced that technology to create better outcomes for patients. In the current state, using robotics is our new opportunity, and that opportunity is something that we're building on even more at this time based on the legacy that Dr. Buehler left us. So what we're seeing now is, again, the ability where all of us come together to use the knowledge and the training that we've had to actually create a better outcome for patients. When you look towards the future of joint replacement, in my opinion, what you're going to see, especially in a place like Central Oregon, is you're going to see our opportunity to look at you, the individual, seeking our assistance to restore your quality of life and being able to more predictably create an outcome from your surgery for you that allows you to participate in those activities that allow you to maintain your own self-care, to be active with your families, and to be able to do the things simply that you want to do.